The dental crisis not only has high economic and financial costs to individuals in our country, but it comes with high social costs as well. Over $100 billion is spent every year on dental services in the United States. Over a third of these expenditures are paid out of pocket. Dental out-of-pocket spending is second to spending on prescription drugs. In addition to the billions that are spent, billions are lost in missed school days and lost economic opportunity and productivity due to dental pain. When people are in agony, their only alternative is to go into an emergency room, which, by the way, is very expensive care. The people in the emergency room are not trained to deal with the dental problems. They deal with pain relief, and that's how we are spending money on dental care.
For the haves, those Americans who currently have access to dental care, that care has grown significantly more expensive over recent years, putting a lot of stress on middle-class families' budgets. We have to do all that we can to address these increasing costs because they ultimately threaten public health and economic security.
The GAO report released this morning notes that only 62% of Americans have dental coverage. Only about 40% of people have a dental visit in any given year. You also noted in your testimony that one important way to expand access to dental care would be for states to consider dental therapists like Minnesota.
Children who miss school because of dental problems do less well in school than other children. Education is the way out of poverty, but children in pain cannot learn. The 165,000 plus dentists in the United States provide high-quality dental care to those patients who can afford their services. Unfortunately, many of these dentists do not participate in the Medicaid program. There are many reasons for this, including low reimbursement rates. But no matter the reason, this significantly reduces access for many patients. Dentists provide significant pro bono care. However, I would remind you that while philanthropic care is wonderful, philanthropy is not a health care system.
The folks who lacked access, the elderly, those on Medicaid, and the uninsured poor, we knew about. But what surprised us was that veterans with limited incomes could not get care. Today, they now have a place to go. Those who journey the farthest are disproportionately people of all ages who have emergency dental needs, and caregivers who bring their developmentally disabled loved ones for care at our sites. Workforce matters. Over the next 20 years, Wisconsin may face 2.2 dentists retiring for each new dentist entering practice, and new graduates need to be better prepared to face more elderly patients with complex medical conditions.
I had an extremely unusual birthday this year. As I was preparing to go out and celebrate with my mother, I heard on the news about the Maryland Mission of Mercy Clinic, where free dental services were being provided. Immediately, I ran out of my home, met my mom outside, and told her we have to cancel my birthday. I have to go to Laurel, Maryland. I spent the night on the sidewalk, but I didn't mind because I was getting a great birthday gift. It turns out that the gift was seeing over 400 volunteers in action, giving their time and hearts to provide over $750,000 worth of free dental work that weekend. I wasn't able to get the dental services I was hoping for, as they weren't able to do specifically what I needed. But I came away with a scene that I will never forget. Men and women of every race, creed, and color lined up for what seemed like a mile in dire need, with the hope of being helped.
As a public health dentist, I think about education, prevention, outreach, and obtaining more resources to provide increased accessibility to care. In Prince George's County, there is an established mobile health fleet that provides medical and dental care to public schools. The county's health department operates the Diamante Driver Dental Project, which is a mobile dental unit funded by the Maryland Office of Oral Health, providing care to children. We address the emergent needs and provide resources for families to establish a dental home. Of 3,000 children screened, 200 were in the A category, potential Diamante drivers, which indicated they had an immediate need, either infection or multiple decayed teeth.
We're going to do our best to focus more and more attention on this issue, why this hearing is so important. We're going to do our best to fight for more money for the community health centers. We're going to take a look at the issue of dental therapists. We are going to take a look at models which seem to be high quality and cost effective. We want to deal with that. I think your point about philanthropy is great, but it is not a solution to a major crisis in this country.